Let's look at the outline. We start with definition, then followed by kind of definition: osteoarthritis, rheumatoid arthritis, gout, infectious arthritis, and blood tests. Then lastly, we go on to the spondylitis and tests.
Today, the definition is as follows. Joint pain is any disease causing stiffness and swelling around the joint, and it is called arthritis. It has been found to affect about 50% of Americans above 65 years of age, and according to the National Arthritis Foundation, it is the #1 cause of physical disability, affecting nearly 60 million adults and 300,000 children. So it cut across. Arthritis affects people of both sexes and of all races, socio-economic level, and geographical areas. None is exempted. So it is a disease or problem for all. Joints are composed of cartilage. The cartilage is that smooth elastic tissue surrounded by a calcium called the joint capsule. The joint capsule, the picture will be shown very soon, is lined with synovial membrane that secretes the synovial fluid, a liquid that even helps to reduce more the friction between the bones. Kind of arthritis. Let us have a knowledge of the different type of arthritis. One, the commonest is osteoarthritis, followed by rheumatoid arthritis, which is autoimmune. When we say autoimmune arthritis, we are saying where the body itself fights against the body. The body produces substances, immunoglobulins, against the body itself. There is also the juvenile rheumatoid arthritis that is also in the line of the adult one that is #2 there. You have commoners in children, 3 types: the systemic juvenile, the polyarticular that affects all the joints both ways. It's not on one side, it is on both sides of the joint, both left and right side, and the post-articular juvenile rheumatoid arthritis. It's always the cartilage. That's where you call it articular. The cartilage has 2 types. There is also the SLE, which is also autoimmune arthritis, where like I've explained earlier what autoimmune arthritis means. The ankylosing spondylitis. This is also very common, and it's ascribed to a specific gene called the HLA-B27 gene. This is the picture. You see the spinal cord becomes stiff, and the person find it very difficult. Though there are exercises recommended for such people. Gout is another type of arthritis. Gout is an inflammatory form of arthritis caused by deposit of sodium urate crystals in the joint. Usually start with the toe joint. Infectious form of arthritis, example is the lymph disease and all the other ones. The lymph disease is caused by a spirochete. You also have arthritis that is more or less called recurrent, which happens after the STD. Somebody has gotten the STD. The young men is a very common phenomenon with young men. Chlamydia, gonorrhea associated here, and the salmonella type is also more or less a reactive, I call it reactive arthritis. That's for the osteoarthritis. The common form of arthritis is osteoarthritis, like I said, also known as degenerative joints. The risk factor is known. You find it common in old age. People who are obese, overweight, injury to that particular point, or repeated joint stresses. Many researchers believe that osteoarthritis is in part hereditary and may be due to genetic abnormalities in the cells that produce the cartilage. The cartilage is really the problem point. You can see the normal joint. This is the cartilage. The cartilage is that covering of the bone. It covers the bone, and this is the synovial membrane that secretes the synovial fluid, which occupies this side and makes the friction very little, no friction, almost no friction at all. But now look at the osteoarthritis. For the osteoarthritis, you find that the cap, that is the cartilage, is gone, and the bone rubs against each other, even producing bone spurs. And this is where the pain comes from, the joint pain, and this is where the swelling. Because when this happens, it is an automatic invitation for the immune response to come in with the lymphocytes or the white blood cells, those cells that will attack and provide immunity to make sure that the problem is a thing of the past. So osteoarthritis is what you have seen. This is the lab where the tests are done, the blood test and other things to really find out and confirm that it is osteoarthritis, more or less. The next one is rheumatoid arthritis. Rheumatoid arthritis also, like I said, is autoimmune. The rheumatoid arthritis is an autoimmune disease that is the immune system attack disorder. It is 3 times more likely to affect women than men, and it occurs most often in the same joint on both sides of the body, such as the hand. So you see, it's part of what is used as the presumptive diagnosis. This is rheumatoid arthritis. Unlike where you find the problem as a result of the cartilage, here it is not the cartilage, but more of an attack, inflamed joint capsule and synovial fluid. The place becomes swollen, all of a sudden loss of space, so it is rather stiff, but you can still see the cartilage is not the one affected, but the fluid, the space here is not there. The fluid is also not there, and there is a minor cartilage destruction, not as pronounced as this, but it is autoimmune. It's the body itself attacking itself. So let's go to the lab to do the usual blood test that could help us confirm from the picture. You know that the imaging test is very true, but what we are more concerned in the lab has nothing to do with X-ray and the MRI. So the MRI or the X-ray will show those pictures are earlier shown, but the patient blood or synovial fluid are collected in the lab, and the rheumatoid factor test is done, and that can be regularly shown by the hemagglutination that will happen, or latex fixation, more or less of a complement fixation test, and precipitation test. These are tests done in the lab to really confirm the thing as rheumatoid factor, rheumatoid arthritis. There will be elevation of the rheumatoid factors. It's also, because an autoimmune test, all the other autoimmune tests could be done to confirm, like the anti-nuclear antibody could also be done, and that will also be raised high, which is very diagnostic. Gout is another form of arthritis. Gout is one of the most severe frequent rheumatoid The clinical manifestation of gout arises from uric acid crystal deposition in the musculoskeletal tissue during catabolism. When you are talking of puric catabolism, you more or less are talking of the genetic factors, because we know purine as a part of what is used to be the nucleic acid, and as final end product in human, because of the lack of uricase that could keep the uric acid to allantoin. But the explanation here is when this catabolism, the purine is broken down, the final end point is uric acid. It should have been probably broken down more, but when this happens, the kidney will have to excrete it. But if you have excess of it, then it goes into the blood and moves straight away to certain areas to cause serious damage. And one of the areas it moves is the joints area of the leg, when you're talking of joints, it penetrates those areas, and immediately that happens, the body immune system reacts. The neutrophils are also attacked because it's, the uric acid is the monosodium urate. That's the crystals. Once it's in high number, it is sedimented as crystals, and very sharp, so it destroys and cause more suppurations, that is more pulsars to be produced, which stiffens that area and creates more pains. The explanation will continue to have it as we go on. That initially affects a single joint, and it progresses if untreated. The risk factor is age, that is decline in kidney function due to age, excessive meats. When you eat excessive meat, protein, high blood pressure, and beer consumption all increase endogenous purine production, as well with cell and tissue catabolism during forced diet or tumor cells dialysis. All these are very important risk factors that one can avoid in order to not have it. But the truth is, some are probably the way they are made, they could withstand it, and it never comes down to gout. But some people, more like it's hereditary, do have it in large quantity. So it is not something that is a general thing that you can say if you take too much meat, even another person could take equally large quantity, large amount of meat or drink, and will not come down with gout. So this explains it. This is the joints, and these are the crystals that pierce, and they invited the scavengers, the monocytes and the neutrophil, and also complement activation, inviting other immune response. But these are very sharp, destroy even the neutrophil, the phagocytes, and creating a serious situation of pus being there. The tissue injury and inflammation now is what you now see in this picture. You can see the inflammation of the synovial fluid. So the seriously affiliation, and this is uric acid crystals there. So the pierce and more injury really cause this. The laboratory is a place where the test for the cause could be demonstrating the presence of monosodium urate crystals in the joint fluid or trophus as being the gold standard for the diagnosis of gout. We could also do ESR and CRP are also elevated. They have high level. Uric acid test is also high. So that is how we confirm it in the lab. The lymph disease. This is caused by Borrelia burgdorferi, and it causes a rash, often in a bullseye pattern, and flu symptoms. Joint pains and weakness in the limb can also occur. There are 3 stages of this. One is the localized lymph after the bite. The bacteria is localized. The third is early dissemination. It starts moving the spirochetes bacteria, and then it is disseminated, late dissemination. These are the spirochetes. You can see spiral form. Maybe that's the reason why they are giving that. But the name is Borrelia burgdorferi, and this shows the infectious arthritis. Infectious arthritis, you have the 3 grades. You have the viral arthritis, the reactive arthritis, and the septic arthritis. The viral arthritis is you find viruses like the hepatitis B, rubella, mumps, tuber virus, and parvo, displaying serious arthritis, problem, swollen joints. The reactive arthritis, these happen, they are post-infection arthritis. The person must have gotten this Campylobacter, Yersinia, Salmonella infection, chlamydia, all these. Some of them are sexually transmitted, like the Reiter syndrome, like sexually transmitted in men. And the next thing is it spreads to the joints. So you have post-infection arthritis, and the HLA as some of them you do not find the bacterial invasion when you do the culture of the synovial fluid. So the suspicion is always associating the genetic loci HLA. When you this type B27 is associated with this. Then the third infectious agent is when it is septic. This is reactive. The septic one is you find the organism. They are there. Staphylococcus aureus, Salmonella, Haemophilus influenza, Neisseria, gonorrhea, Mycoplasma, tuberculosis, Borrelia burgdorferi, and the Borrelia myoni. So, great feature of lymph diseases. These 2 often influenza you find in children may affect multiple joints, that is Neisseria, gonorrhea. The last one, which probably included here, is the ankylosing spondylitis. It's of interest too. It is due to chronic inflammation of the spine. This is also, the spine is joined anyway, but it's unlike the other joints we have been talking about. As the disease progresses, that is, the inflammation of the spine progresses, joint inflammation around the bones of the spinal column or vertebrae may cause these bones to fuse. It becomes steel, and the person finds it difficult to walk very well. So disability becomes obvious. It usually develops before age 40 and is 2 to 3 times more common in men than in women. This is a repeat of that picture that we saw. Very stiff, difficult to move easily, and the spondylitis is associated with Klebsiella. Klebsiella is a bacterium that you can easily isolate in the lab, and it has been suggested that the antigenic similarity between Klebsiella and the HLA B27 antigen provoke a cross-reactivity immune response that causes the disease. So it becomes so easy when you are able to isolate Klebsiella to be wary, more especially from a blood sample or from the urine. You want to really be wary of its causing a problem in the future because of its similarity with the HLA. There is that reaction, immune reaction that could happen. Thank you for